President, please recognize the beautiful chairman of the Finance Committee.
Thank you very much, Mr. President. I appreciate the kind words of the Majority Leader. However, I think that those adjectives trivializes the work that I do, which entails much more than looks and beauty. Okay, I appreciate it, but really, it's not. I don't consider it a compliment. I think it trivializes the quality of the work I do in this institution.
I withdraw all those adjectives.
Yeah, but really, yes. But thank you very much. I know it was said with full kindness and also in jest. Yes. So, Mr. President, esteemed colleagues in the Senate, it is my honor to sponsor today Committee Report number 395 on House Bill 7449 covering the Supplemental Appropriations for fiscal year 2018 in the amount of 1,161,710,000 pesos, which amount is intended to provide for the much-needed health assistance to the Dengvaxia vaccinees. This committee report likewise takes into consideration the following Senate bills. Senate Bill numbers 1794 and 1795, filed by this representation and Senator Richard Gordon, respectively. Both have the same titles as House Bill 7449. And Senate Bill number 1769, filed by Senator J.V. Ejercito, which is an act establishing the medical assistance program for the Dengvaxia vaccinees and appropriating funds therefore for other purposes. According to the Department of Health, this health assistance program for Dengvaxia vaccinees will be composed of the following. Medical assistance program, which will be allocated 945 million pesos or 81% of the fund. Public health management for 148 million pesos or 13% of the fund. And human resources for health, HRH, deployment, 67 million pesos or 6% of the fund. The above allocation will also be used to provide medical assistance for hospitalization, outpatient care services, procurement of supplies and medicines, including the issuance of Dengvaxia assistance cards to facilitate the availment of hospital services. 25 million has been allocated for the last item alone. This health assistance program will likewise entail the hiring of additional 1,250 nurses to be deployed in regions 3, 4A, 7, and the NCR region to accelerate the profiling of the vaccinees, which will include demographic profiling, assessment of pre-Dengvaxia and post-Dengvaxia medical status, and physical examinations. For the implementation of this health assistance program, the DOH will execute memoranda of agreement with different public and private hospitals to implement and facilitate the availment of the medical assistance program. The funding for this supplemental budget will come from the refund from the Zwillig Pharma, the local distributor of Dengvaxia Sanofi Pasteur, covering the unused vials of Dengvaxia vaccine, which has been remitted by the Department of Health to the Bureau of Treasury. The National Treasury, in compliance with Section 25(4), Article 6 of the Constitution, has issued a certification that the 1.1 billion is actually available in the National Treasury to support the proposed Supplemental Appropriations, House Bill 7449. Lastly, Mr. President, the committee would also like to place on record that different organizations and associations representing the families of children who were administered the Dengvaxia vaccine were likewise invited during the public hearing so that they could be consulted on what the immediate needs are or how this health assistance program can be effectively implemented. These organizations representing families coming from the 4 affected regions are United Parents Against Dengvaxia, the Dengvaxia Care Organization, the Parents Alliance Justice Against Dengvaxia, and the Samahan ng Mga Magulang Anak ay Biktima ng Dengvaxia. Mr. President, distinguished colleagues, this bill has been certified urgent by the President. Let us do our part in allaying the fears of the parents and families of the almost 900,000 individuals, both children and adults, who had been administered with this vaccine. Dengvaxia was originally intended to help reduce, if not eradicate, the dengue incidence in the country. It was most unfortunate that the public was not informed of its accompanying risks. Let us earnestly hope that this health assistance program will not be too late in terms of making sure that we keep our children, most especially, safe and healthy. I therefore urge and appeal to this chamber that we pass immediately House Bill 7449 under Committee Report 395 without amendments. Thank you.
Thank you, Mr. President.